Okay, we will resume with Unit 5, Part 2, Accident Prevention. Residents are at risk for accident for many reasons. Some they have impaired mobility, some have impaired vision, impaired hearing, and dementia, or they're unfamiliar with their surroundings. Common accidents in long-term care. Falls is the number one, and failing to identify a resident before care is given. Burns and scalds, poisoning, choking, cuts and abrasions. Falls prevention is very big in long-term care. Falls are the most common cause of injury in long-term care. There are approximately 1.6 million residents in long-term care. Within any given year, 50% of those will fall. That's half of 1.6 million will fall. Approximately 65,000 of those will get a hip fracture. Often that hip fracture is kind of the beginning of the end, so we want to avoid falls at all costs. Half of those will die within the first year after a hip fracture. 1,800 more die yearly from other injuries related to falls. Falls prevention. Identify at-risk persons and report to the nurse. At some nursing homes, they have like a yellow sticker that they put outside their door so you know that that person is a falls risk. You also need to know, if your person is a 1 or 2 assist with walking and ambulating. Keep frequently used items near the resident. That's part of your beginning and ending task to make sure you place everything close to them so they have what they need. Respond to the call lights promptly. Wipe up spills immediately. Remove clutter from the hallways. Get help when moving a resident when in doubt. For sure, do this. Lock bed wheels before giving care. Lock wheels before helping residents in and out of a wheelchair. I will say that you're locking wheels on a resident in and out of a wheelchair, but somebody who self-propels themselves in a wheelchair, you don't lock them because that keeps them from getting around. But when you are transferring, you always make sure you lock the wheels of a wheelchair. Return beds to the lowest position after care. You don't want them to have to jump high out of bed because you left them way up in the air. Side rails up if ordered. Not all beds in a nursing home have side rails. Proper fitting clothing. You don't want their pants too long where they can trip over them. Non-skid socks need to be worn, or socks and shoes. That's the only 2 options. You would never get anybody up with bare feet. Non-skid mats in the bath and shower. No throw rugs. You won't see throw rugs in a nursing home. Elderly people home, those are trip hazards. Report loose handrails. Brightly colored tape to mark uneven areas. Frequent trips to the bathroom. Okay, active fall. If your resident starts to fall, use your body to slide them to the floor. Do not try to stop or catch them. All falls must be reported and an incident report filed. Identification. Residents should always be identified before providing care or serving meals. Failure to ID could result in serious illness or death. Some facilities use photos while some have signs outside the resident's door. Like I said, in a nursing home, they're not going to have armbands. Burns. Check the bath or shower water temperature. Extreme caution when serving hot drinks or food. Monitor temperature of heating pads or warm soaks. Use caution when residents outside on a warm sunny day. Low settings on hair dryers. Spills may cause burns. If smoking allowed, tell residents about the smoking precautions. Treatment of burns, call the nurse immediately. If clothing is on fire, use a blanket or coat to smother the fire. Apply cool water to stop further damage. Poisoning. Store nail polish remover, soaps, shampoo, and other similar items in a secure location. Somebody who has dementia is confused could possibly drink those. Do not leave cleaning supplies in patient care areas, and check bedside tables for spoiled food. Someone who has a problem with hoarding, or they may put food in their drawers and you may find it 3 weeks later, and if they were to get a hold of that and eat that, then they would have food poisoning. Treatment of poisoning is to call the nurse immediately. Try to determine what the patient has taken and save the container. Moving on to choking. Dysphagia means difficulty swallowing. So elderly do have trouble swallowing sometimes, and that leads to them being higher risk for choking. Aspiration is inhaling food or fluid into the lungs. So that's why it's important that we make sure that we sit them up when they're drinking or eating. If they aspirate food or liquid into their lungs, they can develop what's called aspiration pneumonia. Preventative measures for choking: sitting up when eating, usually a 90-degree angle if you can get them that high. Feed slowly, cut food into small pieces, report difficulty swallowing to the nurse, make sure dentures are in place and fit well. If a person can speak and is coughing, you should not intervene. But if they are unable to speak, then that's when or cough, then that's when you need to do what you learn in your American Heart Association CPR and choking Heimlich maneuver. Cuts and tears. Residents should keep arms and legs inside the wheelchair when you are moving the wheelchair. Do not wear jewelry that can scratch the resident. That's why we say just a simple band, nothing that has any sharp edges. Keep your fingernails short. Their skin is so fragile, your fingernails can cut them in a second. And be aware of sharp objects or corners. If you have a pet resident that is bleeding, you're going to put on gloves. Hold a thick pad, clean cloth, bath towel over the bleeding site. Push down hard until help arrives. If it bleeds through what you're using, then you just add to. You don't take the old one off. You just keep adding to. Seizures is involuntary contractions of muscles. They can involve a small area or the whole entire body. Your main goal during a seizure is to keep a resident safe. If you're the one who sees it start, it's very important for you to time it. A seizure should never last longer than 5 minutes. Have someone call the nurse immediately or use the call light. Do not leave the person unless you must do so to get help. So, put on the call light, holler down the hall, whatever you have to do, but don't leave somebody having a seizure. Seizures. Move furniture away to prevent injury. I don't know what happened, sorry. If a pillow is nearby, place it under the head. Do not try to stop the seizure or restrain the person. Do not force anything between the person's teeth. Do not place your hands in their mouth for any reason. You could be bitten. It is common for when somebody to have a seizure for their jaw to clamp down, and sometimes they bite their tongue. They used to, a long time ago, say put a bite block in their mouth, but now they say that was breaking people's teeth. So we just don't do anything, but definitely don't put anything in their mouth. Fainting. If a person faints, you're going to help the person to a sitting or lying position, head lower than their heart. So that's the ones you have them bend over if they can and put their head between their knees. Call for assistance immediately, and fainting could indicate a medical problem. Sometimes it's dehydration, sometimes it's a heart issue. Incident reports. We mentioned incident reports when we talked about falls, but an incident report it documents the incident and response to it. You always want to do facts, not opinions about what you think would happen. Incident are not a part of the patient's chart. They're just something that the facility uses to keep track of accidents and see what they can do to prevent further accidents. And that's it.